How to use best health insurance comparison sites properly. Beginner mistakes that cost you. Health insurance comparison sites are powerful tools, but beginners often misuse them and end up with incomplete coverage or higher costs. You won't believe what a small mistake can cost. The first mistake is entering incorrect personal information. Age, location, and household details affect premiums. Inaccurate data produces misleading quotes, so double-check every entry. Another common error is focusing solely on price. The cheapest plan may exclude essential coverage like prescription drugs, paternity, or mental health. Evaluate benefits carefully, not just cost. Many users forget to check plan networks. Some low-cost plans restrict access to preferred doctors or hospitals, leading to higher out-of-pocket expenses. Always verify provider access. Another mistake is ignoring deductibles, co-pays, and out-of-pocket maximums. Low premiums may come with high costs when care is needed. Assess total potential costs before enrolling. Finally, some rely entirely on online comparisons without contacting insurers. Quotes may differ from actual plan details. Confirm terms and coverage directly to avoid surprises. To properly use health insurance comparison sites, provide accurate information, evaluate benefits beyond cost, check networks, consider total out-of-pocket expenses, and verify details with insurers. Avoiding these beginner mistakes ensures you choose the best plan for your health and budget.